And then after you received your doctorate in higher education, what did you do?
Then I moved to USC.
So that would have been in 1972?
71, 72.
Okay. Did you, during the course of your advanced studies, ever receive implant training?
Yes.
And when was that?
That was in 1967, 1966, 1968. It was at that time was just beginning.
Okay. And what was the type of implant that was being used at that time, if you recall?
At that time, it was the blade implants. It was the very prototypes, and it was time. It was just beginning at that time.
And did you receive this implant training with the blade type of implants at Pittsburgh?
We had the continuing education courses.
Okay.
We had speakers come and give courses at Pittsburgh at that time. Yeah.
When is the next experience you had with implant training after you left Pittsburgh?
Immediately after that, I would say all the way to in 1980, when the Brånemark started, we were attending all kinds of courses, reading about it and all of that. But the serious go back into implantology did not happen till the American Dental Association Council on Education made it required that programs in endodontics, which I became later endodontist, include in their training information about implants.
Okay, so from 1972 to 1980, while you were at USC, you attended lectures and seminars and things relating to implant technology.
Only as an educator, right?
Okay, and were you using any implants at that time?
No.
Okay, and you mentioned something about how it related to endodontics and how you were able to use that. Please describe that a little better for me.
Very good. Although I have double degrees, and they are very closely related to each other, when I moved to USC, I limited to my all my career to endodontics. So in USC, I was hired as an endodontic faculty member, as well as an educator. I was supposed to be director of education for the school. As a matter of fact, I was the director of dental education from 1972 up to 76 or so.
And this was as a result of having the doctorate in higher education and dentistry.
Yes.
Okay.
Dr. John Engel at that time was the dean.
Okay.
And but later on, I limited all my activities to clinical work in endodontics. And then we trained specialists in endodontics.
Okay, and when you say you were really limiting your work to clinical work, tell me what exactly that entails.
Well, basically, clinical work means you're teaching the specialty, you demonstrate it, you teach courses, you give continuing education courses. That's what it means.
Okay, the dental students.
The dental students, right.
Okay, so going back to this implant technology that you were talking about while you were at USC,
right.
You mentioned the name Brånemark. Was that the major implant manufacturer at the time?
It was. It was. In 1993 or 4, I'm not exactly sure, okay, the Council on Dental Education made it part of the criteria for accreditation of dental institutions that we teach the students, the graduate residents, specialists in endodontics, in implantology. And in that time, Brånemark was the main situation. So for me to get knowledgeable and updated in this area, we wanted to take courses to meet the requirement for accreditation.
Okay.
So that's how I went back into it.
Okay, and can you describe for me on the record how implantology goes with endodontics specifically?
Okay. The question really should be asked the ADA, okay? Because they made it a requirement that we should teach exposure and diagnosis, treatment planning, indications, contraindications. CG is the alternative to endodontics. What do I mean by that? When you do a root canal and it doesn't work, then you have to remove the tooth and put an implant. So in endo, there is a procedure called retreatment. You do it over when it doesn't work, first time, second time. And many times you eventually have to extract the tooth and place an implant in its position. So that's why the educators were involved into this.
Okay, so sometimes when the endodontic treatment fails, then there's no other choice except an implant.
Exactly.
Or no tooth.
Extraction or no, nothing.
Okay. Now, you said that while you were at USC, you were pretty much specializing in the endodontics.
Only, yeah.
Only endodontics. And presently, you're still with USC, correct?
Yes.
Okay, and what is your position at this time?
I'm the chairman of the Department of Endodontics.
Okay.
I'm the director of the graduate program. But I've been on leave the past 2 years.
Okay, and where have you been for the last 2 years?
Saudi Arabia.
Okay. So that would have commenced in 1997 sometime?
Exactly.
Okay, and what are you doing specifically in Saudi Arabia?
Specifically, we are implementing an advanced program. It's called the USC RKH program. Its purpose to train the Saudi dentist in this hospital in current advanced dentistry techniques, specifically USC-style dentistry, and to upgrade their clinical competence, specifically in areas of prevention, children treatment. Endodontics is the main thrust. Periodontics, which is treatment of gum diseases and so forth, and the rehabilitation prosthodontics, so 5 areas.
Okay, and this is a special project and you were selected to go there for this purpose?
Yeah, this is a project which we started as a contract between the School of Dentistry and the Armed Forces, in Saudi Arabia. It's called the USC RKH program. RKH is Riyadh Kharj Hospital.
Okay.
Yeah.
Okay. And these doctors, these dentists are in the military hospital there? Or?
Yes. Yeah. But they are civilian, work in the hospital as well as military.
Okay. And how many dentists are you overseeing?
First year was 17, now 15, 32.
And when you mentioned that you were teaching them USC-style dentistry,
yeah.
What did you mean by that specifically?
Well, USC is one of the best institutions, maybe in the country, in clinical dentistry. And our techniques are current, state-of-the-art usually. And they were very much interested in learning these techniques. We also had many students from there train at USC, and many of those went back there.
Okay.
So it's natural to continue the training. And in addition to myself, we have professors from USC go annually. So far we had about 8. They go for a period of 2 weeks, 10 days to 2 weeks. And we had Dr. Saunders, we had Dr. Nazari, we had Dr. Gail McDonald, we had Dr. Namazika, we had Dr. Calvin Lau, and I have about 12 more to go.
Okay, and so they come on a rotation basis, and they teach.
We have a schedule, advanced schedule.
Okay, so these are all advanced areas that they're teaching to the students.
And each one gives their best knowledge in the area.
Okay. Is implantology being taught as part of this?
No, it's not the objective.
Okay, and when Dr. Nazari went there, what did he lecture on?
Periodontics.
Periodontics. Okay. Now, how long are you anticipated to stay in Saudi Arabia?
The original agreement was 3 years. We have, this is, in this end of July will be 2 years, and then we have 1 more year.
So July 2001 is your anticipated return to the United States?
Yes.
Okay. And what are your career